Good morning. I'm Dr. Robert Rutledge, and I thought I'd take a few minutes to help you understand the preoperative process if you decide you'd like to go ahead and have the mini-gastric bypass with us. We've created a preoperative process that we think works well. We've used it for over the past 10 years, and it helps you learn more about us and us learn more about you in preparation for deciding to go ahead for surgery. The steps are as follows. The first thing to do is read through the selection guidelines. These are just guidelines, so we do sometimes do patients who don't meet the guidelines perfectly. So as an example, the guidelines say patients should be between 18 and 55, and we occasionally do younger and older patients because they're just guidelines. But you need to review those, look over them, and understand what kinds of patients we are likely to choose as our best candidates for surgery. The next step is to join our online mailing list. This is a group of over 7,000 people. It's hosted by the Yahoo groups, and you can join it by going to our website and clicking on the Join Us or Talk to Other Patients link. This will give you an opportunity to listen in to the discussion of over 7,000 people who have either had the surgery with me or are about to having. You'll gain a lot of information, and what we recommend is you join that, listen in for several weeks or several months as you begin to think about the mini-gastric bypass. The next step is to fill out what we call our patient information form. On the left-hand side of our website, clos.net, you'll see patient application, or in the upper buttons across the top it says application form, and this is about a 300 question questionnaire, which is pretty demanding, so you'll want to print it out, read it, handwrite some of your answers to get ready, because otherwise oftentimes your computer will time out. And you want to fill that form out, the patient information form, and that will submit it to our computer database. The next step is you'll want to download a copy of our manual and read it. The manual is about 130 pages now, and it's fairly dense and difficult to get through, but it'll give you a lot of information about the type of surgery we do, the mini-gastric bypass. Plus it'll give you some of our opinions about the lap band, the Roux-en-Y gastric bypass, the biliopancreatic diversion, and the sleeve gastrectomy, all of which we have very mixed feelings about. The next thing you'll want to do is contact your medical doctor, take him in a copy of the manual and an explanation that for patients who want to come to see us, especially for patients who are coming from across the country or around the world, we want to have the support and assistance of a local medical doctor to help take care of patients over the coming years after their surgery. We're always available by telephone or email or by local clinic visit, and there's no charge for any clinic visit after the surgery. But for people who are far away, we think the help and assistance of a good local medical doctor is invaluable in having a good long-term result. So one of the things you'll need to do is see your doctor, discuss with him or her the plans for the mini-gastric bypass that you've had, and see if he or she supports that, and if they are willing to write a letter that they'll participate in your usual medical care following surgery. The next step is to write your own what we call patient letter. Basically, this is a documentation of your having read and learned about the mini-gastric bypass. It's a discussion about the other kinds of surgery, the risks of obesity, the risks of the mini-gastric bypass, and your commitment to follow our instructions for your lifetime following the gastric bypass. The next step is a psychological evaluation, and essentially here all we're looking for is trying to determine for sure that patients don't suffer from serious psychological problems that might prevent them from having a successful gastric bypass. The next step is to contact a minimum of 10 of our previous patients and discuss with them their experience with me personally and the mini-gastric bypass in general, ask about the hospital and their results, and discuss that privately with them. This information is collected by you, and then you fill out a form on our website called the Contact Information Form, and we keep track of that. The next step is we ask you to have your family write a letter. This should include a discussion about your situation, about the risks of the surgery, and your family's discussion with you about the risks and the benefits, and their feeling that they support you in going ahead with the surgery. You'll also have a clinic visit before surgery with us, and you'll fill out a consent form, which is 17 or so pages long, which again tries to enumerate the details about the surgery, particularly focusing on the risks as well as the benefits of the surgery. All these things will generate a stack of paper, which we internally call the packet, and as soon as that's done, you mail that to us, and we review it, and with a few days after that, if all goes well, you can be scheduling your surgery. I hope this helps. For any more questions, don't hesitate to call us anytime. Visit us on the web at clos.net. That's CLOS, 4 letters, CLOS.net. You can email me anytime at DRR, that's Dr. R, at CLOS.net, or feel free to call me at 702-215-9550. Take care. Talk to you soon.